We'll be getting back to the issue of security in just a jiffy, looking at it in depth. But right now to the story we had touched on earlier, Ebola. And the two American humanitarian workers who contracted the deadly Ebola virus while working in Liberia have actually been discharged from Emory University Hospital, which is in Atlanta, after tests showed that they were free of the virus. The pair was treated with an experimental drug. However, scientists have cautioned members of the public against pegging their hopes on the drugs, and it has not undergone, as it has not undergone the requisite tests.
2 weeks ago, nobody save for authorized medical practitioners would have dared to venture anywhere near Kent Bruntley, the missionary doctor diagnosed with Ebola. Thursday, however, was a new day, one in which he emerged triumphant and apparently Ebola-free. Brunt is one of 2 Ebola patients discharged from the Emory University Hospital in Atlanta this week.
Dr. Brantley has recovered from the Ebola virus infection and that he can return to his family, to his community, and to his life without public health concerns.
I'm thrilled to be alive, to be well, and to be reunited with my family.
33-year-old Bruntley and 59-year-old Nancy Wright-Ball, both American missionaries, were infected with Ebola while working together in Liberia. They were airlifted to the United States for treatment. According to reports, Bruntley's condition deteriorated so quickly that doctors decided to give him an experimental drug in a last-ditch effort to save him. He and his colleague Nancy were the first people with Ebola to be treated in the United States. They were also the first humans to receive the experimental Ebola drug called Zimap. Both are no longer a health threat. While the discovery of Zimap is seen as a breakthrough, Dr. George Nakitare, the acting director
from some association of to be trained on how to handle,
warns that the recovery of the 2 cannot be attributed to the drug just yet.
Those kind of studies must be expanded to include humans, what they call the clinical trials, where some group of people are given the drug or the preparation and another one given the placebo, so that they see comparisons whether it's actually the drug that is working or some other factors.
Zimap has also been given to 3 healthcare workers in Liberia who have shown a marked improvement, but about half of the Ebola patients in the outbreak are surviving without the experimental drug. Marvin Kai, an orthopedic assistant who contracted Ebola while treating a patient in Liberia, left hospital after making a full recovery on Thursday. Church members welcomed him home with worship songs, declaring his recovery a miracle. This while a Spanish priest who received Zimap later died. As the debate about the effectiveness of the drug rages, the drug's manufacturer, MAP Biopharmaceutical of San Diego, has said there is no more of the drug left. Public health officials now say, potential cures aside, Ebola can be stopped by ensuring it spreads no further. Wilkis Tanyapwa, KTN.